Remedy, and before I start with the new remedy, let's quickly look at what was told in the last few classes. What remedies we have done till now? Ladam, very good. Ruta, good. Huh? Arnica, yeah, good. Okay. So this was the first question for you, and what was the question here is, recall few remedies for injuries. As rightly told by many of you, we have ladam, we have arnica, and of course we also have ruta. Okay, good. So, indication of ruta in injuries. When do you see? Now you told me ladam, now you told me arnica, you also spoke of ruta. So my question to you is, when do you indicate ruta in injuries? What should be the criteria? Very good. Start madidre. What should be the criteria? When do you indicate ruta? Okay, injury to chest, and if there is tuberculosis which follows after that. Okay, then what else? See, first thing is, in which part you see injuries in ruta? Injuries mainly in the fibrous tissue. When you have cartilage, when you have periosteum getting affected, tendons getting affected, very good. Joints, then what else? Muscles of eye, they go into weakness, not injuries, but they go more into weakness. So when you are looking at injuries, the first thing is, you are talking of tendons, you are talking of fibrous tissue, periosteum, and that's why we also concluded in ruta is a very good remedy for injuries. It's a very good remedy for injuries. Injuries of what? Injuries mainly of bones. Okay. And we also understood that it's a very good remedy for fractures. What will ruta do when you give ruta for fracture? It improves healing by forming more callus. Okay. So we will start with a brand new remedy. And this remedy, I don't know if you have seen the image, must be not much of pharmacy is over for you, but this is a remedy like ladam, like ruta, like arnica. It is more of a traditional remedy, meaning it's more of a remedy which was used since so many centuries for injuries. Okay. So if you just look this image in Google, and I was just checking the Wikipedia. Now what Wikipedia says is, the remedy's name is Symphytum. Okay? The remedy's name is Symphytum officinale. That is the remedy's name. I'll talk more in detail. Now what Wikipedia has got to tell us about Symphytum? See, Wikipedia says, the roots of Symphytum, they were used in traditional medicine internally or externally for treatment of various disorders, including commonly as a treatment for reducing the pains of osteoarthritis. This is what Wikipedia says. And if you again Google, or in the same page, Wikipedia also gives us a small information. See, this plant was commonly called as knit bone or bone set. Please understand the common name. As discussed in the last class, common name will give us a lot of information. Okay. Now what is the information you are getting here is Symphytum. I am not trying to tell you the homeopathic part. Okay. I am not trying to tell you the homeopathic part. This is what Symphytum was used before it was homeopathically used. Okay. So what do you understand by this common name knit bone or bone set? Okay, something related to bone, good. Bone set means? Joining, good. Joining. Knit means, knit bone means, what is knitting? Knitting is again, like for example, many of our mothers, they knit. Fine? Huh? Getting it close. Okay, networking, getting it close. So knit bone or bone set reflects his historical use by Poultices. See now what is Poultices? like in olden days or even today, many of the herbs, or we have this flour and you keep hot fermentation. Okay, fine. In olden days, the leaves and roots of Symphytum, it was used for sprains, bruise. Okay, meaning Symphytum as a traditional medicine was very evident before somebody in homeopathy started proving Symphytum. Okay, so I mean, the roots were mashed, then packed around a broken limb. When dried, they formed a hardened plaster cast. Modern medicine, the orthopedic surgeon, whenever there is a breakage in the bone, they put POP. Fine? So olden days, the root was dried, the root was applied over the broken limb, and this root would become hard and it would form plaster of Paris kind of a thing. Okay, so this is the historical medicinal value of Symphytum. Okay, Symphytum. So I'm just giving you an idea that the remedy that we are discussing today had some traditional usage, and then it was picked up homeopathically. See, one more sentence I got is, it is a remedy of ancient lineage. We find it mentioned in the writings of Dioscorides. So again, if you Google who this person is, he is a Greek physician, very old Greek physician, fine? And he has written Materia Medica mainly of herbs. In history of medicine, some teacher would have told about this great man. So even he mentions about Symphytum in his Materia Medica, in his writings. So this is the small introduction to the remedy that we are going to discuss. So what is the remedy that we will be discussing? We will be discussing a remedy by name Symphytum officinale. And what is the simple thing you got from this? Where do you see Symphytum acting? It is a remedy which has an affinity for bones. Good. It can also affect the joints because osteoarthritis. Okay, good. So what are all the objectives of today's class? What I will be trying to do is, I will try to explain Symphytum under a few common headings. We did in Ledum, we did in Ruta, we will be doing it now in Symphytum. You have something called as common name. We will be telling you about the habitat, part use, sphere of action and ailments of Symphytum. That will be our first objective. And second, we will be looking at the injuries of Symphytum, which for a first year student is very, very important. It is a 5-mark question. Okay. And as discussed in the last class, anything from here can come as an MCQ. So mention the other important symptoms of Symphytum, meaning other than injuries, where else we use Symphytum is what I am going to explain in detail. Okay, explain in detail. Fine. So we'll go ahead. Okay. So see, first objective, if you just recall, under the introduction I will be trying to explain, or I will be trying to give you the common names, habitat, part use, sphere of action and ailments. Okay. So stick to that objective, and you don't have one, you have many common names of Symphytum. Notes is ready, I will be giving you the notes. Please concentrate on the class. Knit bone, we already saw from Wikipedia. We also saw bone set. Comfrey is a common name of Symphytum, and healing herb. This is how Symphytum was commonly known among the people in the olden days. Okay. So 4 common names you need to remember, and Boraginaceae is the natural order. Natural order. If you are lucky, there can be a question in your MCQ. Name a remedy which is from the natural order Boraginaceae. They might give you Ledum, they might give you Ruta, they might give you arnica, and they might give you none of the above. What will be the answer? None of the other. Because symphytum was not mentioned there. Okay. Done? So, what is the part? It's a plant. It belongs to plant kingdom. So, are we using the entire plant? Going back to the Wikipedia, what was the most used part? Roots. From olden days, the roots were used because root had, I'm discussing, root had something, gelatinous material, which they found very useful in healing fractures. Okay. So the root before the flower blooms, roots before the flower blooms, they are taken, a tincture of the root is prepared and it is homeopathically used. Okay. So habitat, where do you see symphytum growing? Symphytum is mainly seen growing in Europe and US. Europe and US. Okay. Europe and US. And this herb was introduced homeopathically by one Dr. Jins. Okay, master prover. Okay. And sphere of action. We realize it acts mainly on two very important areas. One is the cartilage and the other one is the periosteum. Cartilage and periosteum. Okay. Done? Cartilage and periosteum. Okay. So this is the first objective. Any quick questions? Any quick questions? See, these are things that you need to understand and remember. Common name, natural order, prover, sphere of action. Sphere of action becomes very important because this is one thing that we'll be taking into the next heading. The other things you'll have to remember and keep it. Okay. Any quick questions here? Common names? How many? 4. What were the 4 common names? Bone set, neck bone, comfrey, healing herb. Okay. And source to which it belongs to? Plant kingdom. Plant kingdom. And I spoke to you about the natural order, the part we use. Part use can also be an MCQ question. Okay. Roots before blooming. Habitat and sphere of action. Okay. Now we'll quickly look at the sphere of action. As I just mentioned here, the last part, it mainly acts on the cartilages and the periosteum. Which is the other remedy that should come here? Ruta. Very good. Good. Ruta. Though we also spoke of ledum. Ledum had no affinity on the bones. Okay. Fine. So cartilages and periosteum. One remedy you will be writing in brackets is Ruta. Good. Now we'll get back. We'll look at the ailments from ledum had its own ailments. Ruta had its own ailments. Okay. Now we look at what are all the ailments in symphytum. Okay. Now again this image will remind you another remedy. Good, Ruta. So where did I put this image in Ruta? Fractures, very good. Injuries to bones, fracture. So one of the important ailment of symphytum is fractures. Injury to bones. See, not only fractures, the second ailment you see here is, what is this? What is this? Can boxing be an ailment? What is this? Yeah, good, very good. See, I'm happy when I ask what is this? Good, it is boxing. Very good. So here, when they box, what do? They give a blow. They give a blow. Ailments from blows. Ailments from blows. In ledum we had ailments from, what was it? Punctured injuries. Fine. Here in symphytum we are having ailments from blow. Tomorrow, assume somebody had a fight and they had blow on the face and they come to your clinic. Okay. So what is the remedy you think of? The remedy you think of is symphytum. Yeah, good. I'll come to arnica. I'm happy. You thought of arnica. Here we will not give ledum. You're getting my point? Here you are not giving ledum. Here you are giving him ruta, or you are giving him symphytum, or you are giving him arnica. We'll discuss. Good. So ailments from fractures, ailments from blow, and what is this? What is this? Ailments from Ailments from wrestling. Here it was boxing. Here it is wrestling. Ailments from wrestling. The only remedy mentioned in our Materia Medica, pain in back after wrestling. Pain in back after wrestling is symphytum. Is symphytum. Single remedy. Again, it can be MCQ. Okay. And ailments from fractures. Okay, we saw injuries, and we are also seeing ailments from fractures. Okay. Are the ailments clear? How many ailments? 4. We spoke of blows. We spoke of injuries to the bones or to the periosteum. We spoke of wrestling, and we also spoke of fractures. See, one more ailment I would like to add here is sexual excess. What is it? Sexual excess, meaning a man or a lady is too much indulging in sexual activities, and if he or she comes up with back pain, you can think of symphytum. I mentioned this, I'll talk to you about this symptom a little later, but for time being, 4 ailments, and you can also include sexual excess. Now before I take up the very important part, quickly, what did we discuss? We spoke of introduction. Under that I mentioned common name, I mentioned natural order, I mentioned habitat, prover, part use, preparation, and we also looked at sphere of action. And then the second thing we spoke just now was ailments from. Any quick clarification? Acting on cartilages, periosteum, it can cause pain. Okay? So, I don't know if we have any questions. Yeah, directly we'll be looking at a very important area. See, for a practitioner, when you start practicing tomorrow, this piece of information is very, very important. Okay? Now, what is that information? I'm trying to give you injuries of symphytum. For a first year student, it is a 5-mark question. Okay? And as you start growing with homeopathy, you see this getting applied either in your 3rd year, final year, or during your internship. You'll be seeing some seniors, some of your teachers, physicians in the hospital using symphytum. Or after you finish your BHMS, you'll also get a chance, opportunity to use symphytum. So where do we use symphytum? Now the practical aspect of symphytum. Okay. So one thing we saw here was, what is it I told you? Injuries. And what injuries we are talking about? In symphytum, the injuries is mainly to the periosteum. The injuries is mainly to the cartilage. So you just see here. Now this is the cartilage. It's a connective tissue. This is the cartilage. So cartilage or the periosteum, the outer covering of the bone, periosteum, those two things can get injured. Okay? Those two things can get those two things can get injured. Fine? Cartilage or periosteum. Okay? Now, injuries to cartilage, injuries to periosteum, this is very, very important. When they have excessive pain, see, there is an injury to the periosteum or there is an injury to the cartilage, and if they have excessive pain, pricking pain, stitching pain which remains after the wound is healed. Understand the statement? There is an injury, okay, the wound has healed, but in spite of the wound getting healed, the stitching and pricking pains remain. Okay, there you can think of symphytum. Okay, yeah, this is the character of pain I was just trying to share. Now, another very important area. Commonly, we practitioners, we use symphytum mainly in fractures. Now, what is the indication of symphytum in fractures? What will symphytum do in case of fracture? It will help in healing, first part. It will help in healing. Second thing, it can reduce pain. Because of the fracture, whatever pain is there, that pain can be reduced with Symphytum. I told you in the last class, broken bones, with medicines we can't join. Okay? We can help in healing. We can help in callus formation. We can help in reducing pain. Done? Okay. So what you see here is, facilitates union of fractured bones. Facilitates union of fractured bones and lessens peculiar pricking pain, favors production of callus. Very important. Favors production of callus. In brackets, which is the other remedy? Which is the other remedy which favors good? Ruta. See, when you tell softly, voice will act on your confidence. If you're confident, you will be very loud. Okay? So your voice determines how confident you are. So Ruta, beautiful, good. I'm happy with the speed. But next time I'll appreciate if it is more loud. Good, Ruta. Ruta also has this character of helping callus formation. Healing through callus formation. So union of fractured bones, non-union of fractures, pain in bones or periosteum after injuries. This we already saw in the previous slide. After an injury, if there is pain which is persisting, you can think of Symphytum. You can think of Symphytum. So going ahead, see, Symphytum may be considered the orthopedic specific of herbal medicine. Meaning, what the orthopedics surgeon would do way back, before orthopedics was so much advanced, way back they were putting that, plaster, that root extract, they were applying it over the broken bones, which would form a cast and it would help in healing. Okay. So this can also be a MCQ for you. Name the orthopedic specific of herbal medicine. Okay. Fine. So this is how things can happen. Now look at this image and two small questions that will come up. What could have happened? One. And second thing, as a homeopath, as a budding homeopath, being in first year, what remedies will come to your mind? First question? Yeah, I know. Yeah, you're a little fast. Good. So first question is, he would have had a blow. Okay, he or she, I don't know who it is. The patient would have had a blow. We'll not look into the reason why he had a blow, but he had a blow. Done? He had a blow. So as a homeopath, two remedies will come to mind. I was having a discussion with a few of your friends before class. There somebody was asking, I don't know who it is, somebody was asking about arnica. Yeah, good. That one of your friend was asking a question about arnica. I told him, boss, just wait for some time. We'll be discussing in Symphytum class. Now what do you see? See now, when arnica in this situation and when Symphytum in this situation is very, very important. Somebody is coming to you in this stage where you see the blood, okay, is clotted, fine, is clotted, okay. Here the remedy will be arnica. Here the remedy will be arnica. Now what will arnica do? What will arnica do? If you go back to the pathogenesis of arnica, arnica has an alkaloid. What is the alkaloid of arnica? Arnicin. So arnicin, the alkaloid, acts on the capillaries and it helps in absorption of blood. Okay? Okay, it helps in absorption of blood. That's why in many cases you will be seeing in future head injury when there is a clot. The homeopath, not big clot, let's not be too optimistic. A big clot requires surgery. A big clot requires surgery. Don't give arnica and expect, magic. We have our own limitation, let's be honest in it. So a big clot, it requires surgery. Fine? Okay, but arnica, many head injury cases, arnica has done wonders. People who have gone into coma after head injury, after arnica, they have come out of coma. It's a beautiful remedy. Right? So what you need to understand is, arnica will help in relieving the pain, it will also help in absorbing. Okay. But when there is the pain which is persisting, and when there is a blow, where is the pain? What is the injured area here? Go back to your anatomy. What is the injured areas? You would have seen skull in your anatomy lab. Orbit. Now what is orbit made up of? Bone. Which is the remedy which acts on bone? Symphytum. So when you have these bony pains which remains after a blow, the remedy is symphytum. Okay? Black eye, arnica symphytum. Arnica symphytum, black eye. When you have all the blood getting clotted there, arnica, beautiful remedy. Okay? So, injuries to the eyes from blunt instrument. Now what do you mean by blunt instrument? If it was from a sharp instrument, which is the remedy? You are getting the clarity?
Yes, sir.
Tomorrow a patient comes to us with injury. What is the next question we are going to ask him? Boss, how did the injury happen? Fine, sir. If it was with a sharp injury, then arnica symphytum bruta has no scope. The remedy is ledam. This is the clarity you need to have. Now here, what we are seeing is, from blunt instrument, what could be the blunt instrument? Blunt instrument could be your own fist, your own hand, whom you are giving a punch, a blow. It could be that, or like for example, see, snowball. I don't know how many of you have visited a place which is, Kulu Manali, I don't know, where you get this opportunity to play with, with ice, we make snowball and we keep hitting each other. Fine? Behind, back, this, wherever. Unfortunately or fortunately, if it starts hitting the eye, okay, it can also call for symphytum. Doctor sir, मेरे को इधर दर्द है. Sir, I have pain. Since when? Okay, we were there and my friend, my wife, husband, whoever it is, he hit and it hurt and it pains. So, snowball, cane, stick, or point of umbrella. Accidentally you open umbrella. Many times it happens. Fine? Accidentally you press. Now you have all those pressing things. Now you press and suddenly it opens and it hits your eye. Fine? Or another beautiful example. See, beautiful example. A practical example. Mother, she would come with a black eye, or mother would come with some issues with the eye. Accidentally the infant, the small boy, would have pushed his hand into the mother's eye. Not purposely. You didn't give me milk, chalo, dish. Not this. Accidentally it would have happened. And then the mother lands up in your clinic. The remedy is symphytum. Done? Are you clear? See, you need to have clarity, because number of remedies are increasing slowly. Arnica, ledam, ruta, now symphytum. Slowly, though I don't want to use the word confusion, slowly, many remedies you feel a little worried. Yeah, you feel a little, let's not use the word messed up, confused, because we are trying our best to keep it simple so that you don't get confused. We want you to have that clarity. Okay? So, symphytum injuries is what is very important. We'll have a quick recall and then we'll go back. What is the common name of symphytum? Healing herb, bone set, knit bone, comfrey. Beautiful, good. All clear with the common names? And where do you see symphytum acting? Cartilages and periosteum. See, this is just the beginning of your BHMS. This should continue till your final year and even after that. That's how you should remember. Okay. When I tell and when I immediately ask, it's easy. Yeah. Fine. You can reproduce it very easily. You can answer back very easily. But we want that to remain remain for a longer duration. Okay. So third thing is ailments. Blow, wrestling. Don't tell boxing. Blow. See, don't take boxing. Ailments from boxing. Meaning somebody who goes and stands in the boxing ring, we can't give him Synfetam. Doctor साहब मेरे को Synfetam दो, तो 2-3 लेके आ जाओ, blow. Only then we give him Synfetam. Just getting into the boxing, we are not giving him Synfetam. Okay, blow. I just gave you that image because I felt that is the commonest thing now where they get the blow. Fine? Done? Okay? So wrestling. And what would happen in Synfetam because of wrestling? Back pain. Cares called back pain. Done? And then in what type of injuries Synfetam is indicated? Blunt injuries mainly to bones, good, and cartilages. Okay, periosteum and cartilages. Fractures, we discussed fractures. And yeah, before I forget, see there's something called as phantom pains. I wanted to tell you this. Phantom pains. For example, if the leg has been amputated, it's been cut off for some reason, and patient feels pain in this part. Okay? That part is cut off, but is feeling pain. So this is what we call it as phantom pains. Okay? So phantom pains are in the operated bone. Okay, if they have pain there. We call it a stump, S-T-U-M-P, operated stump. If they have pain or pain in the leg that has been cut off, phantom pains. Please remember, phantom pains. It can be a question that can be asked, phantom pains. Okay? See now, before I close, we'll look at what was the last objective. We look at other symptoms in Synfetam other than injuries. Okay. See, if you just see this here, from the knowledge of your anatomy, this is the stomach. Okay. And the mucous membrane of the stomach is being eaten off. Okay. Now this is what we call it as ulcer. Ulcer in the stomach. Okay. Gastric ulcer, peptic ulcer, gastric ulcer. So they have seen that the root which we were talking of has some jelly-like substance which when taken, it acts on the ulcers and it helps in healing. What was the other area where this jelly-like thing would help? It would help in broken bones. Okay. So one more area where this remedy can help is gastritis, gastric ulcers. Okay. So I'll just read it as given in books. Ulcers of stomach, root contains a crystalline solid that stimulates the epithelium on ulcerated surface. So gastric ulcer, Synfetam can be a very important remedy. Not only gastric ulcer, there is something called as psoas abscess. Again, from the knowledge of anatomy, you can just go back home as an assignment. You can read psoas muscle. Okay. In psoas muscle, if there is an abscess, that condition is what we call it as psoas abscess. Synfetam is a remedy for psoas abscess. Psoas abscess. Okay. And what is this? And what was the cause for back pain in Synfetam? Sexual excess. It can be injury, no issues. But specifically, after sexual excess, I told you a little while ago, after sexual excess, if there is back pain, one remedy could be Synfetam. Back pain from sexual excess or wrestling, somebody told that, right? Or from violent movement. After a violent movement, if they come up with back pain, you can think of Synfetam. Okay. Now the last and very important thing is, it's a very good remedy for sarcomas. Sarcoma. Right? So see, sarcomatous tumors. See, a tumor is a growth. Okay, cancer. Cancer of jaw. Okay, cancer of jaw, fine, or cancer of bones, cancer of muscles, cancer of fibrous tissue. You can think of symphytum. You can think of symphytum. Okay. Though symphytum is usually thought of in injuries of bones, you also have to remember few other indications. In Viva they might ask you, or it can be useful in your practice tomorrow. And again, a very good remedy for osteoarthritis, knee pains, joint pains, symphytum. Okay. Now before I close, we'll just look at the objectives that we have set. At the end of the session, the learner is able to list a common name. Common name clear? 4 common names. And we also spoke of habitat. Where do you see symphytum going? Okay. And then important will be scarification. Cartilage and periosteum. Ailments from injuries, blows, fracture, wrestling. Good. Wrestling. Sexual excess. Done. And describe the injuries of symphytum. 5-mark question. Okay. And the other symptoms of symphytum. What were the other symptoms? Gastric ulcer. Good. Psoas abscess. Then osteoarthritis. Then sarcomatous tumors. Then last thing, back pain, which mainly comes from sexual excess, wrestling, or violent motion. Okay. Any confusion? All clear? Okay, we'll stop. Children, thank you. So next class we'll start with a brand new remedy. Okay. Thank you so much.